Hello, my name is Qiyana, and I will be persuading you all to donate to the American Cancer Society. So, 5-year-old Ariana was diagnosed with stage 4 neuroblastoma. 21-year-old Jamie was diagnosed with stage 3 colorectal cancer. 30-year-old Amber was diagnosed with stage 4 kidney cancer. 45-year-old Vanessa was diagnosed with stage 3 breast cancer. And 27-year-old Donovan was diagnosed with stage 2 melanoma. From this list of cancer patients, a list that unfortunately many of you have someone in mind that can be added to this list, one can gather that cancer knows no bounds as it can impact individuals from a variety of different demographics. Now, while cancer does not discriminate against a person's age, gender, or race, there is an increased cancer mortality and late diagnosis rate for non-white individuals of a lower socioeconomic status. According to World Cancer Day, Black women are 40% more likely to die from breast cancer than white women, and Black men have twice the prostate cancer death rate than white men. Modern Healthcare 2023 states that 2020 saw 9.4 million missed cancer screenings in the United States. Screenings for breast and cervical cancer fell by 94%. Despite this, Black women are still 41% more likely to die from cervical cancer than white women. That alone is very devastating. My mom was an African American woman diagnosed with stage 4 breast cancer at age 45. At the time of her diagnosis, my mom's tumor was about the size of a cantaloupe, maybe bigger than that. And the cancer had metastasized to other areas of her body. Her symptoms were missed for years prior because she could not afford to get the right tests done in time. Watching my mom battle this disease, I learned that many people of color's cancer go undetected due to lack of access to care. Today, I would like to persuade you all to help eliminate some of the barriers standing in the way of individuals with cancer getting treatment by donating money to the American Cancer Society. There are two main obstacles that stand in the way of a cancer patient receiving care. The first obstacle is not having the money or health insurance to get treated for cancer. Hilaire 2011 has linked the high mortality rates of certain cancers in minority groups to later disease detection, which may be partially be from lack of screening or underuse of cancer screening practices. Hilaire also identified barriers to cancer screening, which include socioeconomic factors, limited access to preventative healthcare services, lack of insurance, lack of knowledge about cancer and cancer screening, and language barriers for some immigrants. African American women tend to have lower rates of breast cancer incidence when compared to their Caucasian counterparts, but have higher mortality rates and are often diagnosed with more advanced stages of disease because of a lack of breast cancer screening, just like my mother was. The second problem that there may not be enough treatment options for every stage in every cancer. As stated by Worldwide Cancer Research 2022, there are over 200 distinct forms of cancer with many subtypes for each. So what works for one patient may not work for another. Treatments can stop working, and the cancer can become resistant and even mutate further. With there being a growing number of cancers, it is imperative that research is being funded for doctors and scientists to seek out solutions. Now that we have discussed the two main obstacles, let's discuss how we all can pitch in and help. We, as a collective, can donate to the American Cancer Society, a nonprofit organization with 81% of funds going towards supporting cancer patients and their family survivors in cancer research. It is a very simple and quick process of going to cancer.org and clicking the big red button that says donate, or going straight to donate.cancer.org, and then the page just pops up right up for you. So one can donate however much or however little they want, as frequently or as infrequently as they like. So a little goes a long way, and you'll feel the satisfaction of knowing you have helped better the lives of people with cancer. I encourage you all just do a little bit every month. Now, while failing to contribute isn't the end of the world, I'd like to inform you all on something. According to the City of Hope Cancer Center 2023, 1 in every 2 men and 1 in every 3 women have a chance of being diagnosed with cancer in their lifetime. So, this could be you, your significant other, your kid, one of your parents or both, or your friend. If it was you or someone you cared ever so deeply about, wouldn't you want to maximize the amount of support you or they could get without going into debt? Please help give yourself the best chance of survival in case it happens to you. As we have reached the end of this speech, I urge you all to donate to the American Cancer Society. Keep in mind that donating will go towards expanding cancer research and supporting cancer patient survivors and their family. No contribution is too small.